I'm Joseph Barnard. I'm one of the family medicine doctors here at Ozarks Healthcare. So I chose family medicine because several different reasons. I like to do a lot of teaching. I like to investigate different facets of medicine, and all that was kind of the best fit for my personality. I like to sit and get to know people and their families, and so it just seemed like a perfect fit. So I'm from a small town. I grew up down at Gainesville, Arkansas, and then we moved to West Plains when I was about 10 years old, and I always liked the small town environment, and so I wanted to go back and practice medicine in a smaller town. My personal philosophy on patient care is just, I always treat everybody like they're my own family, right? So everybody always has questions or they need a little more explanation on kind of what's going on, and I'm just here to provide that. So the reason my job is enjoyable is one, is helping people. When you can reach a diagnosis and get them treatment that they need, it's kind of like the most important thing that can happen in their life. And I just enjoy working with people and their families. So I've been with the organization since 2001, and honestly, everyone has kind of always felt like family here, and I've enjoyed the people that I've worked with, and I wanted to come back and help take care of this community. For fun, I enjoy golfing, I scuba dive quite a bit. We're building a house at the lake, and so I enjoy spending my summers on the boat. So I'm married. My wife, Kissa, is an RN. I have 2 children. My son, Dagan's 24. He's into his second year of medical school. And then I have a daughter, 19, and she is getting ready to study nursing, graduate with her bachelor's. Both of them are at Mizzou currently. I have my best friend is my brother, who lives next door to me, and his wife and 2 kids, and my brother and I are who usually get into the most misadventures. We golf together and boat and fish together. Well, I'm kind of the first person in my family that really delved into healthcare, and so for my kids to follow, I don't know, it puts a smile on my face, I guess. You know, they kind of went after what Dad was doing, but also just their contribution to humanity through providing healthcare, I think, is pretty awesome. Probably one of the coolest patient stories that I have. It's not really a single patient, but it was a group of patients, and it was during my 3rd year of residency, and I was on night shift, and so it's a lot of nights in a row, it's a lot of long nights, but there was one night in particular where I had a patient who came in and essentially had blood clot from his feet all the way up to his heart. Within an hour or 2, there was a young pregnant woman who came in that also was like in eclampsia and began to have seizures and whatnot. And so in the moment, it's kind of all like a blur, but I know that we were able to get everybody situated, stabilized, got them to the help that they needed, you know, whether that be cardiothoracic surgery, vascular, or with one of the OBs that came in, we were able to start medications on the young girl. And so, you know, if anything bad's gonna happen, it's always gonna happen like right before shift change. And so that's when all this kind of occurred as well. And so I ended up working over about 2 or 3 hours, but everything got taken care of, everybody stayed alive, and then everybody was super grateful afterwards. And so it was probably one of the best nights I had in residency, and also just one of the most fulfilling nights I had as a person. So the reason I chose to work in Gainesville is because I like the small town feel. I always wanted to provide family medicine to a small town, and so that's predominantly the reason I chose Gainesville.